From August to September, North America was hit with 3 hurricanes: Hurricane Harvey, Category 4 hurricane, Hurricane Irma, Category 5 hurricane, and Hurricane Maria, also a Category 5 hurricane. The destruction of these hurricanes have been devastating. Hurricane Harvey displaced more than 30,000 people and caused 89 deaths. Similarly, Hurricane Irma caused at least 134 deaths, and Hurricane Maria at least 93 deaths, and is recorded as the 10th most intense Atlantic hurricane on record. The economic losses caused by all 3 hurricanes are estimated to be around 70 to 200 billion, over 62.9 billion, and over $51.2 billion respectively. Clearly, they have collectively caused catastrophic losses in infrastructure. However, its impact extends beyond structural damage to properties, towns, and cities, and into short and long-term health fallout. What kind of fallouts exactly can we predict for these hurricanes, and what are some policies or methods we can use as preventative measures as to lessen the burden of the destructive impact we have been left with? Let's find out. A common observation is the rising incidence rates of arboviruses, also known as vector-borne illnesses, after a hurricane hits. A study done by Kai Yu et al. Demonstrated an increase in West Nile neuroinvasive disease after Hurricane Katrina hit by comparing incidence rates in affected regions with 2 controls: current unaffected neighboring states and previous incidence rates of West Nile in the affected regions. However, there is still a debate on whether or not flood-related disasters such as hurricanes demonstrate such an increased proliferation of arboviruses. Research by Nasi et al. Concluded that the vast majority of natural disasters, with the notable exception of the Red River flood of 1975, showed no increases in transmission of arboviruses to either humans or domesticated animals. Furthermore, contradictory to Kai Yu et al.'s findings, Lehman et al. Also examined the incidence rates of West Nile and St. Louis encephalitis in affected states, Louisiana and Mississippi, during 2005, the year Hurricane Katrina hit. They conceded that there was a slight increase in the amount of cases of West Nile in Louisiana. However, the times at which the peak cases hit were around the same as in previous years. Therefore, they deduced that the increase in cases was not hurricane-related, and that perhaps such strong winds and stormy conditions could have even decreased the risk of transmission by dispersing or killing vectors of the disease, such as birds or mosquitoes. Though the debate regarding this remains, there is substantial evidence that hurricanes increase the risk of communicable diseases, especially respiratory and diarrheal diseases, after they hit due to displacing large populations. Additionally, the availability of safe water and sanitation resources is compromised due to major flooding. There is often an increased degree of overcrowding, especially in urban areas. And finally, healthcare services often become relatively inaccessible. The most common diseases found after Hurricane Katrina was diarrheal in nature. The CDC estimates that there are around 1,000 cases of diarrhea and vomiting reported among evacuees in Mississippi and Texas, and further tests also detected norovirus in stool specimens from Texan patients. In fact, after Hurricane Katrina, E. coli counts were 100 times higher than those normally found in river runoff. And among the 24,000 Katrina evacuees who were housed in the Reliant Park building in the Houston Astrodome complex, 18% developed acute gastroenteritis. These skin and diarrheal issues are likely a result of the loss of proper housing and irrigation systems due to intense flooding that occurs after such a high-category hurricane hits. It might seem that such diseases are equal and random, affecting anyone and everyone after such a catastrophic disaster. However, there is a growing body of evidence in literature showing that disasters affect the poor and vulnerable disproportionately. Greeno and his colleagues analyzed the demographic characteristics and the acute pre-existing health problems of 499 displaced persons living in shelters in Louisiana 2 weeks after Hurricane Katrina. They found that 50% of subjects had no pre-existing health insurance and 50% had chronic disease. 30% were in need of acute medical attention. Nevertheless, there are methods that can help decrease the infectiousness of pathogens following major natural disasters. For one, rescue workers need to be properly immunized to avoid getting sick and screened as to prevent introduction of foreign pathogens. Portable microbiome laboratories can be set up to rapidly identify foreign pathogens as well. Lastly, knowledge and feasible courses of action for dealing with the identified pathogens and rapid execution of these actions would also help prevent casualties as a result of easily preventable and curable diseases.